Crossover to Nyeri, where residents of Kiawara Town in Kieni are today getting free medical services at a medical camp organized by Kenyatta National Hospital.
Kiawara is one of the towns in Nyeri County, get this, with no hospitals, and residents have to travel all the way to Nyeri Town to receive medical attention. Let's link up with Martin Munene, who is at the camp, for giving us more details. Martin, it's great to see you. This is so unfortunate given that medicine, universal healthcare, it's one of President Uhuru Kenyatta's big four agendas. What is the Nyeri government, what's the Nyeri local government going to do about this?
All right, very good morning to Zinzi and Trevor from Nyeri County. We are in Kiawara, one of the local areas in Nyeri County. It's in Kieni constituency, the most expansive constituency within this particular county. Nyeri County is actually a pilot county when it comes to the implementation of the Universal Health Coverage, or UHC. And the main reason Nyeri is a pilot county is because there are a lot of lifestyle diseases within its population. And as you can see, quite a number of people, the numbers here are quite many, just showing you the dire need the residents have of having access to healthcare. Now, all these people have come here because they've been told they have an opportunity to actually go through a medical examination without necessarily having to spend any money, and therefore they have seen it is important for them to be able to come. And I want to speak to a resident here to help us understand what are some of their challenges when it comes to accessing healthcare. Karibu sana mzee, nataka uniambie unaitwa nani na uniambie nyinyi kama wakazi wa eneo hili mashida ambazo mmekuwa nazo za afya ni gani?
Kwa majina naitwa Sebastian Mwai wa Johi, na mimi ni mkaaji hapa wa Kieni, kwetu ni huko Embariko. Na ile mashida tuko naye sana ni magonjwa ya arthritis na magonjwa ya cancer, hata hii serikali inasema, na tuko na magonjwa ya diabetes, ya sukari na pressure. Tumeshukuru sana kwa mheshimiwa wetu kwa kuleta hii mpango ya watu kupimwa. Shauri ukipimwa watu wakiwa vile wanajisikia watafurahi sana. Sio wakati mtu amelala kwa kitanda ndio unakuja kumwambia apewe dawa, lakini mtu anataka kujijua, ajue afya yake. Na tumeshukuru mheshimiwa, shauri hatujaona watu wengine wakisanya watu kama hii. Tumeshukuru mheshimiwa wetu kwa kutuletea hii mambo. Sasa
na nikuulize, wakati ambapo mnakuwa na magonjwa mnaendanga hospitali wapi, haswa magonjwa ambayo ni makali kama vile unasema arthritis?
Kwa magonjwa hii ya arthritis na high pressure na cancer, iko madispensary na iko health center na iko Livaro huko Nyeri. Tukilemewa na hapa hii mashinani hapa hii hospitali kama dispensary, tunaenda huko Nyeri Livaro. Huko ndio unaweza saidikia. Ukishindwa na huko unatumwa Kenyatta. Na hiyo tunashukuru hata serikali yetu kwa kutuletea hii mambo. Na sana tumeshukuru mheshimiwa.
Asante. All right. And we speak to one of the organizers here. Briefly tell us who you are, and also tell us maybe why have you seen it is important for you to collaborate with the hospital, Kenyatta National Hospital, to bring these services here.
Okay, my name is James Maina Munene. I'm the Kieni NGCGF chairman. One of the essence why we decided to bring this medical camp to this place is because where we are right now, as you can see, it is in the center of the two referral hospitals that actually serve this area. We have one in Nyeri Referral Hospital that is about 40 kilometers from here, and the other one is Nyahururu, which is about 50 kilometers from here. The people from this area really suffer to get the medical, to get to the medical facility, which is far away from here. And the livelihood here is not very, very good. And that is why our area MP, Honorable Kanini Kega, decided to make a collaboration with the KNH Nairobi and KNH Odaya to come and bring free medical camp to people around here. This is where we have some lifestyle diseases and also diseases like arthritis, diabetes, which actually attack our elderly people. We are very grateful for the two hospitals to collaborate with the area MP, because our people in our locals here have actually enjoyed free medical camp. Thank you so much.
All right, and as we wrap this up, I will speak to an expert to just understand what is actually available for the locals who've come here for this medical camp. Briefly come here, introduce yourself and tell us maybe who are some of the specialists or some of the specialities that you're going to be focusing on this day.
Thank you. My name is Stella Githaiga from Kenyatta National Hospital. We are here in partnership with the Honorable Kieni Kega, who's the local area MP. Today, the services we are giving are screening for diabetes and hypertension. We are also doing screening for cervical cancer for women in reproductive age. We are also seeing and treating minor ailments, and those that need referrals for specialized care, we are referring accordingly. As you all know, we now have Kieni Othaya Annex, which is treating patients at the same level as what Kenyatta National Hospital does. Yes, thank you.
She says that they're going to be focusing on those ailments, and what they're saying is that in case somebody needs more medical attention, they're going to be referring them to their annex, which is Kenyatta National Hospital Annex here in Othaya. But interestingly, I must say, yesterday we had a forum at the Nyeri Referral Hospital where there has been a campaign to actually tell people to come for screening, and it was realized that in the one month long campaign, every person who came there, once they were interviewed, it was realized that 88% of the population had never been screened for any of these lifestyle diseases. That's just going to show you how many people out of the population have no idea if they live with these diseases or not. And it was actually said that most of the people only visit health facilities when they feel they are sick and when their health is in, it's already too late for them. And therefore, some of these diseases that can be managed if detected early actually go undetected, and therefore some actually even lead to fatalities. And therefore, maybe such camps, I don't know how sustainable they are, but being able to bring healthcare closer to the people instead of the 40-kilometer distance they have to cover to get assessed or even have this healthcare, maybe this could help. Maybe, make sure that more people are detected early, and maybe some of these diseases that are responsible for the many deaths within this county can actually be reduced. From Nyeri County, I bring it back to you in studio. I'm Martin Munene.